Well, thanks all for staying with us here on Sunrise Live on E on this Hope Day Wednesday. Let's give you some hope this morning. So now there are hundreds of skin conditions that affect human beings, right? Now the most common skin condition can have symptoms that are similar. So it is important to understand really the differences between them. Some skin conditions are minor while others can really be life-threatening. So to get a better understanding of that and some of the skin conditions that exist, and perhaps even you are suffering from one this morning, I'm joined in studio by Dr Hetesh Pitamber, and of course he's going to be taking us through exactly some of the types of skin conditions that exist and how exactly you can remedy them. So of course that is our Ask the Doctor component of the show, which means that you can feel free to give us a call on 011 447 1742, alternatively 1620. Dr. Hetesh, thank you so much for joining us this morning.
It's a pleasure. Thank you for having me, Faith.
Now when we're looking at the most common types of kind of skin conditions that one may have, what are we looking at?
I think eczema is the most commonest, especially now with winter upon us, whereby the skin presents as very dry, flaky skin, itchy, and it presents in the flexures of your arms and legs. And I think the most important thing in patients with eczema or in winter skin is to moisturize your skin adequately. I know a lot of patients use aqueous cream, they think that's adequate enough. In fact, that actually is not adequate for patients with atopic or dry skin. A product like this displayed here is more adequate because it has citamacrogrol and glycerin in it. It helps to trap in the moisture into your skin, thereby you lose less the moisture out of your skin. And also it prevents allergens from getting into your skin because it helps to protect the barrier of the skin. And that is what's important in any patient with eczema, psoriasis, or any of other skin conditions that we present with in winter.
Is it hereditary? And because many of the times, I mean, when you look at a patient with eczema and then you don't necessarily know that I need to go get a checkup or I just need to go to a local store or a chemist and purchase some products. So is it hereditary? Are you more susceptible?
Yeah, eczema, there's a family history of atopy. So there's other atopic conditions like asthma, hay fever, and eczema. They're all related. We call it the allergic triad. So even often a patient, if they have an eczema history, they might even have asthma or hay fever or a family history of those conditions.
And then psoriasis?
Psoriasis also presents as dry skin, as a dry skin condition, but they present differently from eczema. They present as dry, scaly plaques, almost like candle wax. It looks like dandruff, but much thicker flakes. And they can be
sometimes, is it the one where sometimes it can be on the back of someone? Do you know,
like dust, white dust.
And then they've got like when they wear any form of shirts, then it's like flakes at the back.
Quite correct. So you get seborrheic dermatitis, which is the milder form, where the flakes are not as coarse or not as white as the psoriasis gives you very thick flakes. So it's a variation depending which condition you have, but it could be seborrheic dermatitis, which we commonly in kids call cradle cap. And then psoriasis of the scalp can also present like that. And often we need emollients for those type of conditions as well.
Sure. So now we've got one of our producers, right, who she was saying that especially when it comes to her skin, it was acting up. And was acting up, I think it's actually been a period of a few months that was acting up. Her name is Khalalela. I want to invite her into this conversation because we need to take a look at it. She must never say that I don't give her proper special healing techniques at this time. Come closer. Come closer. Now, she can have a seat. So, Doctor, you can see. Now, Khali's displaying some marks on the bottom of her chin, as you can see right there. What causes this? I mean,
so that's what she's got is post-inflammatory hyperpigmentation, which means post means after inflammation. So it's post-inflammatory. So she probably had a rash there that was inflamed and red, and now it's left pigmentation. So probably her skin was dry, flaky, and red. And now she's probably a product like this where you can use a moisturizer to help combat the dryness. So that will prevent it from aggravating the disorder. This usually post-inflammatory pigmentation usually fades with time. So you just have to be patient.
But what causes it in the first time? Because I mean,
the inflammation. The inflammation caused it. But what caused the inflammation? Maybe not using the right products on the skin. Maybe she was.
So in other words, she's supposed to be between these two, my darling. Epimax cream.
I've been using this for a while.
So probably So you can see now your texture of your skin is much smoother and much softer. And if you weren't using it, it would be very flaky and dry.
Okay. So she must continue with the use of this. If it reoccurs, what happens then?
If it recurs, then you should see your GP or your dermatologist to find out why are you having this problem. Because right now we're not seeing her in the active state.
I see.
So we can't say
so
what
this is like
was
almost like the healing state, the post
that's
state.
yeah, post state. That's
Okay.
correct. So we need to see it in a primary stage. She's got one acne-form lesion there on the chin, which was maybe a bit of a breakout. But she's got an oily T, as you can see on her forehead. It's a bit oily.
Yeah.
So she's got seborrhea, we call it.
Seborrhea.
But remember, you can have oily skin, but your skin can still be dehydrated. You can have dry skin with dehydrated skin. So some people have oily skin, but they still feel tight, like I was explaining to you earlier.
Yeah.
So that's dehydrated skin. So emollient like this helps to maintain the hydration in your skin, protects the barrier of your skin so that allergens don't get it and you don't lose moisture from your skin. So you must retain the moisture, especially in winter. In winter, we tend to take longer baths, hot showers for a longer period of time because it's winter, and we tend to be near the heaters much often or near fireplaces. The humidity is
And
less,
obviously
makes you
sucks
tight.
the
Yes.
moisture from your skin. We're going to
Absolutely.
continue there. Khali, thanks
Thank
a lot.
you.
Thank you very much.
Hopefully they've given you a little bit of more
Yeah.
insight in terms of your skin. So in other words, you're not dying. You're going to be just fine. You're going to be just fine.
If she's been to a dermatologist and that hasn't responded to the freezing or cryotherapy, we call it, with liquid nitrogen, then it's better she sees the dermatologist and maybe the lesion should be biopsied just to exclude it's not a skin cancer from the sun.
I got
It
you.
could be, or it could be something else that wasn't adequately frozen. But it's best to see the dermatologist again and say, look, you've frozen this, it hasn't responded, why is that so? It's very difficult to tell you without seeing what the problem is. But if something is not responding, then it needs to be checked out and investigated.
Okay, so it has to respond. You have to go to a dermatologist, and then they might need to actually freeze it.
Yeah, or maybe they won't freeze it again, but maybe just sample a piece of skin
I got
to
you.
see, because it may not respond to freezing if it's something else.
I see.
Yeah.
We've got some more questions that we actually post to you on our Facebook page. So be sure to keep sending those questions whilst we have the doctor in studio with us. I'm going to go with Jody. Jody's saying that my son has red hands and then they become full of blisters and then they become very itchy. Some red spots have also developed on his feet. Doctors are still unsure of what it is. The blisters were on the back of his hands. So redness, blisters, and it's very itchy as well, doctor.
So if these blisters, bilateral, symmetrical, there's a whole range of, we call it differential diagnosis that we think of. But blisters, also it depends on the age of the patient. So it could be a contact dermatitis, usually bilateral symmetrical blisters on the top, could be a contact gloves or something he's playing with. So I think that's something to be considered. Eczema could also present with blisters on the hands.
And feet.
And feet as well. There's lots of other skin conditions, but this person needs to see a specialist.
Sure.
So they can give you the correct diagnosis and the appropriate treatment for the condition.
Okay. So it's best to see a dermatologist.
That's a common problem we face in our practice. What can they do for the marks? But I think what's more important, you need to treat what's causing the marks.
Okay.
Otherwise, you'll be treating marks forever. So it's always appropriate to treat the underlying condition first. So I would treat the acne condition, and as we treat the
So she must treat it like an acne
condition first,
Okay,
and
got
then
you.
the marks will fade with time. So she
Okay.
needs to see a GP or a specialist, and they'll put her on a specific program that is suited for her skin type and her skin conditions, because some female acne conditions may be hormonal, some may not be hormonal. It depends on the age. So certain more appropriate isotretinoin therapy we could use for her, depending on the severity, maybe a course of antibiotics, maybe an oral contraceptive pill to control the hormonal part of it. So there's a lot of factors that you need to think of when you deal with a patient like this.
So what you're saying is that no more on those on-the-counter kind of self-diagnosis.
Yeah, that's not going to
work in this case.
Yeah, just a simple cream just to treat the oiliness or the black marks is not going to sort the problem out.
I got you.
Address the underlying problem, and then the secondary problems will fade with time.
On Facebook, we've got another individual called Sama Sompani who's saying, I've got an itchy body as well.
Yeah.
So what does this mean?
Well, this means he needs to moisturize adequately. Like I mentioned earlier to you, aqueous cream is a waste of time, especially with a patient with very dry skin. You need a reputable product with reputable ingredients in the product, such as citamacrogrol, such as glycerine, other ingredients that are quite effective to help to lock in the moisture in the skin. So he needs to moisturize with emollient ointment, I would suggest. Actually bath with an emollient like emulsifying ointment and use a product like Epimax, citamacrogrol as a moisturizer on top of it.
There's never going to be a situation where it's more than that if it is displaying itchy skin or if he's feeling
Absolutely.
the symptoms of
So
itchy skin.
dry skin will present is a prelude to eczema. So
I
you may
got
have
you.
eczema. We call it xerotic eczema, dry skin eczema, and that's what he's experiencing it. But if you maintain the barrier of your skin, then you already got the foundation of treatment for eczema under control. So if the foundation of treatment eczema is adequate moisturization. So once you get that right, then your eczema will already improve on its own.